While the most visible victims of COVID are adults who end up in hospitals, a steadily growing number of COVID carriers are Oregon's children. Pay attention to the light blue line on this graph from the Oregon Health Authority. It's the number of kids 0 to 5 years old who tested positive for COVID during 1 week, August 15th. It totals 499 babies, infants, toddlers, little ones. It seems like an astoundingly high number, but to those in healthcare like Dr. Ben Hoffman, it is not.
It doesn't surprise me. And I think it doesn't surprise me because we're seeing a lot more kids who have been back in daycare or in childcare. And with the rise, the increase that we're seeing across the board, I'm not surprised.
Dr. Hoffman is a professor of pediatrics at OHSU Dorenbecher Hospital. He said despite the big numbers, few little ones or even older kids actually end up sick enough to go to the hospital.
I'm also not surprised that those kids, like I said, are not getting super sick, which is reassuring. And, I'm really glad that they're not getting sick.
He said there were only 2 positive COVID patients at OHSU last week who were 18 or younger, and both were admitted for other conditions, then found to be positive during routine testing. This chart from OHA shows which ethnic populations under 18 in Oregon are getting infected with COVID. It's ranked here based on their infection rate per 100,000 since the start of the pandemic. Pacific Islanders are tops with a rate of 8,400 per 100,000. Then Native Americans with a rate of almost 7,900 per 100,000, followed by those with more than one race and then those of Asian descent. The largest raw number of kids under 18 getting COVID are white, with 14,800 cases since the beginning of the pandemic, followed by Hispanics with 9,200 cases. But it's that number of little ones, 499 from the age of 0 to 5, infected with COVID in 1 week that grabs attention. And because of their age, they have significant potential to spread the virus to others.
And one of the things that you can think about is likely going to happen with kids 0 to 5 is that an adult caregiver is much more likely to be in close proximity to that child, holding them, just in your activities of daily living, changing diapers and bathing and that sort of stuff.
So Dr. Hoffman said that the majority of children that he's seen that are COVID positive present with what he said are mild cold-like symptoms. And parents, if you worry if your kids are coming down with COVID, Dr. Hoffman says you should call your doctor first before rushing to the doctor's office or to the ER. Often the doctor's office can tell you whether they think your child should be tested and how you can go about that. Also, I just checked around with the area hospitals tonight. There are 8 people who are in the hospitals who are 19 and younger who are COVID positive. And since this all began, the state has been counting. There are 33,661 people younger than 18 who've had positive tests for COVID-19.